Good morning. Welcome to the show this morning. I am Dr. Scott Phillips, chiropractor and local owner of Lifestyle Chiropractic and Wellness Center in the Clock Tower building here in town. And I'm excited to be your personal healthcare expert for the next hour. We have a lot of fun things to discuss, a really fun guest that we've been trying to get on here for just years, it seems like, Amy. And so we're going to talk about some good things going on at our Heber Valley Medical Center. And I put out on Facebook that I'm also going to talk about a carcinogen that we are over half Americans. A new study came out and said over half of Americans over the age of 6 are actually partaking or ingesting this common carcinogen every single day. And so I wanted to throw that out there just as a hook to keep listening, because I'm going to tell you what that is. And I put in quotation marks, it's not fruits and vegetables, by the way. But so we're going to talk a little bit about that. We're just going to have a good old time this morning. But let's get right into it and talk to my guest here. Miss Amy Tuddenham is, and I should have asked you before what your actual title is, but really, I think we could just call you the lady who knows what's going on. And so you're over at Heber Valley Medical Center, and tell me, do you have an actual title, or are you just the one in the know? Oh, check and see if that's on. Sorry, just the on and off switch. Oh, there we go.
Okay, now
Perfect.
I have an on switch on. I am actually, I have an official title. It's or the lady who knows or likes to think she knows everything.
No, you know for sure.
I'm the Public Relations Director for Heber Valley Medical Center, as well as Park City Medical Center.
Well, I didn't know you worked for them too.
They're sister hospitals, and I actually manage all the public relations and communications for both hospitals. I do have staff at Park City Medical Center.
So you don't have to go up there as often, probably.
So I'm not there. I'm
it's quite a drive, and especially in this winter.
A whole 15 minutes. So,
well,
but they're both really good hospitals, and it's good to work to manage both facilities and see where we coordinate and work together.
Good. So. Well, like I say, we're really excited to have you on. I know you got lots of stuff to talk about and things to tell us about and all that kind of stuff. So I guess let's jump right into kind of what's going on over there, what you want to kind of update us on. And the thing that you told me in the text message was the pool and kind of things that are going on at the Aquatic Center. I think that's a really cool thing to talk about, especially if you're doing the lessons and things like that. So tell me the updates. What's going on over there?
Oh, well, just a funny anecdote. We've been doing community rounding with like our civic leaders, our county council, and every time I leave one of those meetings, I get a text from a friend or a colleague that attends those meetings with us, and they go, "Wow, you are busy. You must be exhausted." And we are very busy. The hospital is growing, and we're very, very excited with the direction that we're going. What I brought today is some information on our swim lessons. So about 18 months ago, we purchased the Fit Stop building, which we've now renamed it the Heber Valley South building. And in that building, we've added a lot of services. All the tenants that were there stayed.
Right.
We opened our physical therapy. We opened our dialysis center, which actually, just a quick update, we started with 6 patients. We're at 9 patients.
Wow.
We're going to be actually going out and raising money for 3 additional machines, because we have 3 or 4 more patients in the queue that would like to transfer to our center. So we're very pleased with the service that we opened, and we were talking yesterday about the impact healthcare makes on residents of our community, and how having that center here may not impact, a lot of people, but for those 9 people, it's a huge impact for them, a benefit that they're not driving 2 or 3 times a week down the canyon. They don't have people taking them. So we're really pretty pleased with that. So in that building, we got the pool up and running. And we have lap swimming, which is Monday. Lap swimming is Monday through Friday, 5 a.m. to 9 a.m. And then we open again from noon to 2 for lap swimming. And then next week, our evening hours expand. They just used to be 5 to 7, and now they're going to be 5 to 9 p.m.
Nice.
So that'll be really nice. And then we've got water aerobics classes. We've got water aerobics in the morning, and then we've got an aqua fit at night. 2 weeks ago, we added mom and taught swim classes, and those classes are taught by Lisa Fowler. And if any of you have interacted with Lisa Fowler, she's amazing.
I don't know if I've met her.
Okay, you'll have to
I
come
need
over
to.
and meet her.
And she needs to come on the show, too. I know we were hoping she might come today, but maybe she'll come later. But
Well,
that's
she
awesome.
teaches swim lessons at Heber Valley Medical Center on Wednesday, and then on Thursday she works over in Park City.
Oh, okay.
She worked and I know she used to work for the National Ability Center teaching their
Okay.
adaptive swimming classes.
Yeah.
She is just amazing. And so I know that Thursday she spends over at Ecker Hills in their pool teaching adaptive swimming and all of her swim lessons as well.
Cool.
So she apologized last night that she couldn't make it, but
Yeah,
we'll
I'll have
see
to
when
meet her for
she
sure.
has a Thursday that she's available. So next week, or actually March 4th, is when our swim lessons for levels 1 through 6 start. So the Mom and Me classes started a couple weeks ago, and we actually filled the first week of classes. We can have 3 to 8 pairs. So the first class right now we have about 4 pairs.
Okay.
That's a mom and a kid.
Yeah.
In the water, and we just wanted to start with one class, make sure we had all the registration kinks worked out,
Right.
make sure Lisa had everything she needed, and then on March 4th, we will start all of our lessons, level 1 through level 6, and she's actually going to teach a whole day, so it'll go 9:30 until 6 p.m. She'll be in the pool with lessons.
Cool.
She'll pull out for the lunch swim hour, and then she starts up again. She is an incredible teacher. I grew up in Phoenix, so we swam a ton.
Right.
And it is so fun listening to her background of swimming and how she teaches and how she works with the kids. She's very engaged, and it's a lot of fun to be even near the pool with her.
Yeah. Well, I know a big thing with swimming and everything in the community that, people talk about there's not enough room at the current pool, and everyone's always asking about swim lessons. And so I think it's not a surprise that the Mommy and Me classes took off so well, and I think this will be another thing that just really quickly gains a lot of steam. And I'm with you. I grew up in Texas. I mean, we swam.
Yeah.
To hear people here that don't know how to swim, I'm like, well, what do you do in the summer?
What else is
Because you
there
have to be in the
besides
water,
swimming?
or you'll die of heat exhaustion. So yeah, that's really, really exciting. I was going to announce also really quickly, if anyone out there, again, I always forget and then I remember sometimes, but if you want to call in, ask Amy any questions or me any questions, for sure, the phone lines are open. The phone number here is 657-1340 or 657-1340. So if you have any questions about the swim lessons, about anything Amy's talking about, or just anything in general, feel free to give us a call and chat with us this morning. So anyway, so we got swim lessons. What else? You got all these papers over there. I'm ready for you.
I brought all these papers because Lisa wasn't with me, and she's very specific about the swim classes that she teaches. One thing that I want to make really clear is the pool that we have in physical therapy, it's a small pool. And I know we've had some questions about, that pool will fill the need of the community pool. If you haven't been over to the hospital and seen the pool, it is a small pool, and
Sure.
it won't fit the need of a community pool, but it'll fill the gap until we come to a
Right.
solid resolution within our community.
Well, and I think that's the great thing about it is, like you say, it's not huge. It's not this big mega complex or anything, but I'm sure it's also not packed all the time. I mean, I'm sure there's definitely room for people to come in. And
You know what? There is. I know that before the holidays, I was a consistent swimmer, and it was perfect.
Yeah,
There was
yeah.
3 or 4 of us
Right.
in the morning hours, and we just rotated. There's a group of women that come in from 7 to 8:30 every day and swim. So you can usually find time
Yeah.
where you're not jumping over or swimming over someone else for
Right.
lap swimming.
Right.
We created it to have kind of a more serene spa feel
Sure.
than just a loud
Kids splashing.
splashing pool. I know that I have taken my children to do lap swimming with me.
Yeah.
I feel it's really important that we teach our kids to exercise,
Yeah.
and we get them out doing the things that they enjoy. So occasionally when they have wanted to come along with me swimming, I take them and I pay the fee for them to just come for the one-time use
Right.
and let them swim in the pool. We do have 2 pools. That's the thing that I want to educate you on.
Sure.
We have a lap pool that's 23 yards long, and it is 3 lanes. And then we have the heated pool. And the heated pool is a 13 by 15 therapy pool. And some of the lessons will actually be held in the heated pool.
Yeah.
The mom and tot classes, just because sometimes the water is a little chilly for those little
For the little
6-month-old
guys,
babies.
yeah.
We do that in the heated pool. And I should have asked what the temperature of the pool is. I know the heated pool is probably in the 80s. Because we want it to be warm enough for those
Right.
babies. Plus, we have a lot of our therapy patients that go into that pool to do their water therapy. After a major surgery or an injury, during rehab, water is actually a better place to begin those therapies to recover and heal your bones
Yeah,
and muscles.
definitely. You take a little bit of the gravity away, and it's
Yes.
a lot easier to move them and all that kind of stuff. It's a great way to for therapy for sure.
So, and then we transition to the lap pool when the patient's ready, which is at a cooler temperature, more for an athlete,
Right.
like that's training for a triathlon or something.
Yeah, trying to swim laps in 80 degrees gets
It's a little miserable.
gets warm quickly.
It is miserable. So it's a great pool. I just want to give you a summary of the classes that might help you determine which class your kids
good
need
call.
to be in. So the Mom and Me class is for children that are 6 months to 36 months. And kids really practice safely entering the water, jumping in the water, rolling to their back and floating. They're drown proof. So growing up in Phoenix, we had a swimming pool, and my mother did not grow up around a pool, but my father did. And so I just remember them telling stories about when we were about 7 months old, my dad got in the pool and he had my mom just drop us.
Yeah, yeah.
And, you know, back in the 70s, there probably wasn't this huge formalized swimming process like we have now. But my mom said that was the scariest thing for her, is dropping us in the pool. And weeks, every day after my dad would get home from work, they would say, my dad would get in the pool, my mom would drop us, and he would be close enough to get us. But in that process, he would help us learn to turn around, swim to the edge, learn to turn around, swim to the edge. And you would think a baby couldn't do that, but it is so important.
Yeah.
I mean, we don't, a lot of our community doesn't have pools, but we have lakes so
Right,
close
right.
where kids need to know water safety and they need
it's
to know
important.
swimming. So that's an important class with that Mom and Me class. And then the level 1 is for children over 3 years old, and they learn the foundations of swimming through songs and games. They work on things like blowing bubbles, flutter kicking, wall crawl, jumping off the side, and then swimming back to the wall. 4 years, and then level 2 is 4 years old and up, and they just continue to build on that swim foundation. They also begin to explore the underwater world. They work on submerging the entire head. For some kids, that's a huge panic.
Big time.
To go completely underwater.
Yeah, yeah.
So we work on that. I think
some adults struggle with that still too.
I think they do. I know some adults that struggle with that. And then the level 3 class, and all these classes are 30 minutes long.
Yeah.
The level 3 class is for 4 years old and up. Again, they work on independent swimming, but the assistance that Lisa provides for these students gets littler, smaller and smaller. She kind of weans them off depending on her. At this age, we want the kids to be confident in jumping into the pool and safely swimming to the side without any assistance from the teacher. They learn to work on their front glide, their front crawl, and rolling to their back and back glide swimming. And then at this level, 4 years old or level 3, they begin to learn how to breathe on the side and rotary breathing in freestyle and backstroke.
Yeah, yeah.
And so each class kind of builds on the class that they learned previously. Level 4 is for 5-year-olds and up. They practice, they continue strengthening their skills with freestyle. They learn to retrieve objects and dive in depths of 4 feet without assistance. And then they really begin to introduce the breaststroke swimming. And students should be safe in any water at this level. They should be able to swim and float on their backs without any assistance. And Lisa really makes sure that there's always that safety component so that when you do head over to the Camas pool or to the pool at TIS, you're confident that your kid can navigate and get around.
Yeah.
And then we have 2 more classes, level 5, which is 5 years old and up. And they continue to work on everything. But now at this point, we introduce the butterfly stroke. They're comfortable in any depth of water. as well as diving, and we focus on treading water for 5 to 10 seconds.
Yeah.
And then level 6, these are just kids that really need to hone in on their stroke techniques. They learn to tread water for 30 seconds. I know that in some of the classes, as my children got older in classes, and even I remember in high school, we would do those things where not only would you tread water, but you'd learn, what would you do if you ended up in a pool in your clothing. And I know the scouts do this all the time.
Yeah.
They're fully dressed, they submerge their canoe, and that extra water weight from the clothing, it's kind of a drag, but the kids get used to it, and they learn how to maneuver and navigate. So I just think swim lessons are vital for our kids.
Yeah, I completely agree. Now, my question is, as you're talking about all this, because my 8-year-old is about where probably the 4-year-old class is. Mm-hmm. So, I mean, talk about let's say, they don't have to start probably that young if we wanted to get them in at an older age, but they're a different skill level.
Yeah, not at all. If you don't start your children swimming, I think some people really do start their kids swimming at this 6-month age, and others don't. So if your son is at a level 2, which is the 4 years old and up, he would be fine in that class.
Yeah.
And Lisa is really good at integrating all the different kids and their learning levels. I actually met her about a year and a half ago when we purchased the pool. She had called me and she said, someday I really want to teach swim lessons here.
Yeah.
And it was just so engaging to see her vision of what kids, of helping kids develop a healthy lifestyle habit. Swimming is something where I think about running, and I think of sometimes the aches I feel after a half marathon.
All the pounding on the joints, for sure.
You don't feel that swimming, and that's a lifelong habit.
Yeah.
That as long as you can get into a swimming pool, you can swim for a long time.
Yeah, as long as you know how not to drown.
Yes.
You can really. It's true. You can swim for. I've been over at Tiz a few times, and some of the people swimming, I'm like, wow, it'd be nice to be that age and still be as active as those people, for sure. And swimming's a great way to do it.
Swimming is. So, my dad is 73 this year, and he's always been extremely active my whole life. I remember him exercising, taking us with him to exercise when we were little kids.
Right.
And we're starting to see, as his daughter, I'm starting to see the aging effects on him. But something that he always does, he can get in the pool, and he doesn't have those, I'm seeing him slow when he runs, or when we take the dogs out for a walk, or even when we go skiing. But in the pool, he doesn't have those aches and pains.
Yeah.
And so it's something he still enjoys, because it doesn't, he doesn't have that pounding, or the age isn't limiting what he can do in the pool.
Well, and you think of all the muscle groups that you're working, right? big time for your shoulders and your back, for sure. The leg muscles. Everything is working together in that type of exercise. And I always laugh because, I can, like you say, I can go out for a 30-minute jog and feel like, hey, I did pretty good. But when I'm in the pool and really working myself, I look up and it's only been 10 minutes and I'm like just dying, I'm like,
I know.
Wait a minute. I thought I was more in shape than that. So, yeah, it's a really important skill. I think you said so. Half hour classes.
Mm-hmm. The classes are half hour.
And then tell me, do you have price on that too?
I do. I
know you've got a few of those sheets of paper. I should warn you in advance.
I really feel silly having all this paper, but I thought I better take some answers.
But you want to be thorough. I can understand.
I don't want Scott to text me and tell me I was clueless today.
Thanks a lot for coming. No.
So, on the mom and tot classes, it is $10 per pair. So you have to realize with those kids 6 months to 36 months, that $10 is paying for the mom and the baby to get in the class. Now, I had one mom send me a note on Facebook, and she asked, so I have 2 kids under 36 months. Can I bring both of them? Because
we're in Utah. And that's what happened.
But I did have 2 kids under 36 months.
We do too now.
I thought, what would I have done with both my kids and my husband working full time?
Right.
So, with the mom and tot class, we really need each baby or each tot to have an adult with them. Yeah. Just because those first few months in the water, they really need someone with them, even if they're 36 months old. Right. They're on that higher end of that class scope.
Yeah.
Water that big is intimidating for kids, and we don't want children to to come in with a fear of water. So they
Sure.
really need that other adult with them to work on the skills that Lisa's teaching them to help them get comfortable in the water. If you remember, I did all these classes with my kids. When you lay your baby down in the water on their back as you're trying to teach them to back float, their natural instinct is to pull up and not put their head in the water.
Right.
And so, there's some coaching that just setting a little kid on the side of the water while you're working with the other one.
Trying to do the other one. Yeah.
It doesn't work. So
Yeah.
we really expect that there'll be 2 adults. And I even volunteered to be that adult if a mom really wants her kids.
See, look how nice you are.
I know, because
That's $10 per class, right?
Yeah, for the mom and tot class.
And do they do it on a monthly basis, or is it just every time you come you pay your money type of thing?
You know what? You can do both. So how we've set it up is with the mom and tot classes is you can drop in or you can pay in advance and hold your spot.
Right.
So the first week we had a full class, and the mom and tot class is at 9 a.m. on every Wednesday, and at 6 p.m. every Wednesday. So you can reserve your space and pay for the whole month, or you can just drop in.
And then pay it there.
And then pay there. The bonus of being drop in is, you think how often kids get a cold or something comes up, so there's pros and cons both way if you want to do the class. And then the level 1 through level 6 are $15 per student. And then those classes are also every Wednesday, and level 1 is at 9:30, level 2 is at 10, level 3 is at 11 at 10:30, and level 4 through level 6 is at 11. And we kind of did that because we're not quite sure because that level 4 through 6 is, I want to say, the kids that are in school.
Yeah.
And so we know that there's a lot of homeschoolers out there that may really utilize that hour. But during that 11 o'clock hour, we're going to see how many kids we get.
Right.
And then we'll kind of target the class exactly to those needs. If we have a lot of level 4s and maybe 1 or 2 level 6s, we'll be able to work that out. And then she has a break until after school. And then we go level 1 at 3 o'clock, level 2 at 3:30, level 3 at 4, and then at 4:30 we do level 6. That was a lot of numbers.
Yeah,
I hope I'm not confusing anyone.
No, I don't think if you just say starting at 3 and then every half hour go incrementally. But yeah.
So that's kind of how it's set up right now. So we would like for the level 1 to 6 classes to pre-register. I think that'll save people a lot of, disappointment if the classes are filled up.
Right.
But we're always, if you can't register, we always are happy to make it work, and we'll do whatever we can.
And $15 per class, that's probably pretty comparable. I have no idea how much.
It actually is very comparable. So on these Live Well services that we've developed, rather than just set a random number, we really study our market.
Good.
And study what's around us. They are private they're semi-private lessons. So it's just going to be Lisa and this group of 3 to 5 kids in the, they're going to have the whole pool together. So we looked at rates around us, and not only just around us in Heber and Camas and Park City, but we looked at what the market is for that class. And then we set our rates. And that's what we've done across the board with which we call our Live Well services, which are the water aerobics, the lap swimming. We want to make it very affordable, because we at Intermountain Health Care, which it sounds really silly, we're a hospital, and yes, we can provide care for you, but our ultimate goal moving forward is to keep people as healthy as possible, to keep them out of actually needing us.
Yeah, see, that's a bad business plan. You know that.
You know what? It is a bad business plan. But in October, I'm probably taking more time than you really want me to.
No, you're okay.
In October, we met as a senior leadership team, and there's about 400 of us that sit on the senior leadership team. So we're with the president of the company, Charles Sorensen, who's a general surgeon who started at LDS Hospital.
Yeah.
And Intermountain Health Care, we actually revamped the whole mission. And previously, our mission was to provide health care to the community regardless of their ability to pay. And although that's still part of our overall core beliefs, our mission is to keep people living the healthiest lives possible.
Yeah.
And I know that those are not the exact words, but really that's everything that we're doing.
Sure.
We truly believe that we provide the best care if you need to be in a hospital or have surgery or deliver a baby.
Yeah.
But we really think that these live well services are extremely important.
Well, and I think, and I laugh, I said it's a bad business plan. I mean, I have the same business plan, you know, I mean, it really is. I think as the health of any community starts to raise, it becomes a more attractive place for people to live, right? It becomes a more attractive place for businesses to grow. I think it becomes a model then for, again, we need our country's health to improve. We just do. Yes. You know, and I think more hospitals and more sick care and all that kind of stuff, that's what we've been doing for a long time. And it's nice to be able to support people in these times of need. But if we don't give them the skills to go out then and say, okay, now that we've helped you with that and got you out of that emergency, you know, whatever treatment type of situation, you know, if you want to live a good life, if you want your health to improve, all that kind of stuff, there are steps that you have to take. You know, you can't just wait for another crisis then come back to us. I mean, it's almost frustrating because that's what we want, is we want these people that we take care of to leave and lead a healthier life and not come back the same or worse, you know, 6 months later and say, wait, what have you been doing? Why are you back?
Why are you back?
And so I have to say I give kudos to the Intermountain Health Care system. You see commercials, and they really are pushing a lot of this live well type of thing. And I guess maybe if you want to, I don't know your time frame. You can tell me when you have to get out of here, but that was another thing I was wanting to ask you about and kind of was interested in was, you know, what brought about this, you know, change in, hey, let's really push the wellness side of things. You guys are great sponsors too, I know, in the community of a lot of these other types of, you know, health events and healthy events. Where do you see your fit just in our community as far as really being that sponsor of, hey, let's make sure people are living well? And did that come from the top down, or is that something that you guys kind of wanted to start here?
I honestly think that it came both ways. So as a hospital, we understand that people don't always need hospital care, and how we chose 10 years ago when I returned to work, how we chose to get involved in the community was to look at community events that promoted healthy living and wellness. And so as that was just a strategy for the hospital. And I actually think that most Intermountain Health Care hospitals felt the same way, that if we keep our population healthier, that we will in turn have a healthier population, a more engaged population. They'll utilize us for the services that they need, and not for this, you know, and then those extra services, we hope that they diminish and they don't need. Right. If you look at studies, and I know you're very familiar, probably more familiar with them than I am, where I'm not clinical, but if you look at like lifestyle indicators, people with diabetes, if they could just make a couple changes, you would see the trajectory path of where their health is going improve incredibly. Take, for example, soda pop. My kids are very angry with me all the time because I don't stock it in the fridge. But I think that we don't realize how soda pop is linked to diabetes, to heart disease, not to mention obesity and all the extra sugar that you're getting. Right. So I think as Intermountain Health Care as a whole, they put those journals in front of us to read for us to read and study and to understand. And then, so yes, the hospitals were going there years ago, but they hadn't quite gotten there. And then the Affordable Care Act came into place. And my personal opinion is that it's not very affordable. I've had several friends call or, hey, I need to get insurance, and I'm now paying $800 a month, whereas before this Affordable Care Act, it was about $350, and I could afford it for my family of four. And so what Intermountain Health Care did is we looked at the rising costs of healthcare, and we said, we've got to impact this in a more appropriate way. And what we've done is we've created a model where everyone, we call it shared accountability. And in that shared accountability model, the patient's accountable for their health, as the insurance company has a role to play in that accountability loop. And then the hospital also has a role to play in that accountability loop. And so as that's become our vision, we have really shifted a lot to live well services. That's why it was so important for us as a hospital to expand those live well services up here, to open a physical therapy department that could help people that needed physical therapy, to add live well services like the pool.
Yeah.
We have big visions for what we want to do over there. It would be great to start doing executive physicals. I personally have never done a triathlon, but there's so many things that I want to learn.
You've done a triathlon. You really haven't?
I have not.
But you bike, swim, and run. You know that, right?
I know. So I just now need to put the three together. But there's a learning curve there. And so like in our Live Well services, we'd like to do some triathlon training and teach people how to do that brick training. Because sometimes when you start into that brick training, which is putting 2 or 3 of those events together, you get sick or you get an injury because you're overtaxing your body. So we have a great vision. Charles Sorensen, the president of Intermountain Health Care, he is a surgeon, so I think still 1 day a week he is in the operating room assisting other surgeons, visiting with them. And physicians see it. Good physicians see it. And I am very pleased that the physicians at our hospital and in our community, they understand that wellness model.
Right.
And also, and I wish that I would have brought this data sheet that talked about how Intermountain Health Care, we're taking costs out of the system. Through this shared accountability model, we're holding physicians accountable to really assess what needs to be done to the patient. There's actually clinics that have created a prescription pad that say exercise 3 days a week.
I've heard of that. Yeah.
Well, and we're finding for people that don't exercise that it's not part of their, part of who they are. So it's just really funny. My sister despises any kind of exercising and hates it. And I just naturally, I exercise. It's just part of who I am. And we always laugh about it because she naturally hates it. And her husband really wants her to like it. And she doesn't. And so for some of the people that really haven't figured out what they love, and I think that's the key to exercising, they haven't figured out what they love. That prescription helps. Rather than getting medication to lower your cholesterol or, if you're pre-diabetic, going on medication, sometimes exercise, and through that prescription, those people really go, okay, the doctor said I have to exercise 3 days a week. I'm going to do it. So I have to tell you this personal story really quick. My daughter returned home from an LDS mission early, and she was sick. And we could not quite figure out what was wrong with her, but lots of chronic fatigue, fibromyalgia, arthritis-like symptoms. And in the series of tests that we've done, we ended up with a neurologist who told me yesterday that she has a tachycardia. And he says it's very mild, but what it is the heart's not strong enough to pump blood to the brain. And so she blacks out and her heart rate gets really accelerated. And it was just so frustrating to me. And he's not a doctor in Heber or Park City at all, I want to clarify. I said, so explain this a little bit to me. I have a couple questions. And I was asking these questions and I said, so can exercise help strengthen the heart? Because you think that if she's swimming 20 minutes a day, doing some maybe not high impact exercise, that we would strengthen the heart so it could pump that blood better. And he goes, oh, exercise can't do a single thing for this. I'm going to give you a beta blocker and I'm going to give you this. And he went through a list of like 3 medications that he was going to put this 20-year-old girl on. And just to be honest, Scott, I was livid when I left. I got her medical record and I will never go back because if she needs a medication, we will completely do it. But with Intermountain Health Care, what we're coaching our physicians and our providers to do, and it's a best practice. We're not just randomly going off and doing something. What Intermountain Health Care does is always backed by best practice. The patient needs to be accountable for their health. And if she needs a beta blocker, that is totally fine. But there's also other pieces. And the sad thing is he left the room for a minute, and of course we got on our phone and we Googled tachycardia.
What have we done?
Mayo Clinic came up, and it gave a list of things that you can do to help if that's your health condition before you go to medication. And walking 20 minutes a day, swimming 20 minutes a day. And so Marissa was, I think, a little embarrassed that I was so enraged over this stupid thing. But I thought, as physicians, he had a right to communicate to me my other options before going to medication.
Yeah.
And he didn't, and it was frustrating. And it really solidified to me that I work for and I have partnered with a great health company that understands that if we're going to lower healthcare costs, our patients need to be accountable for a portion of their health. Yeah. They need to make better health decisions.
Right.
And I am really passionate about it. And I sometimes, I'm sure, offend people. We were exercising the other night, and my girlfriend picked up a Coke to drink between Zumba, and I just giggled, and I'm sure she was livid at me, but I'm like, really, honey, why are you drinking that?
That's right.
So probably more information than you wanted.
I want you to know that I get very annoying with that also, I'm sure. But you're right. I mean, that's the things I think if people started to really connect those dots and say, look, there's getting health care and then there's being in charge of your health, right? And I think if all we do is go from clinic to clinic, office to office, doctor to doctor, and say, what can you give me? You know what? And we just start, and whether it's pharmaceuticals, supplements, right? If we're looking for that person to give us something so that we can magically become healthy, I think it's the pattern that's gotten us where we are right now in healthcare.
It's exactly the pattern.
That's what we've done. Instead of making the hard decisions, instead of making the things and making the habits that we've gotten out of, we just want someone else to tell us, oh, just do this. And I would share your exact. I might even been even more angry. I don't know, but But when they come in and say, oh, that can't help, and then a simple search says, wait, yes, it can. And obviously, like you say, I mean, if you just thought, oh, exercise is going to help, and she just said, Marissa, you ought to go out and run an hour a day. That could be on the other end. That could actually be harmful. And so you need someone there to help kind of coach you and say, no, this is the type of exercise that would help strengthen that cardiac muscle instead of taxing it more. And so it's sad that you had to get that from Google, and luckily the Mayo Clinic made it, The Mayo Clinic made it really easy. Instead of, Jim Bob's blog. But you're right. I think when physicians can start to counsel and say, look, here's a condition that you're suffering from. Here are some of the options medication-wise. There are side effects to the medication that you need to be aware of. Here are some things you can do on your own to make it so either you don't have to take the meds, or you take a lower dose, or you lessen your risk of some of these side effects. Who wouldn't say, yeah, let me try some of that? Yes. If they wouldn't, then... then that's why our healthcare is so expensive.
That is exactly it. So can I tell you something about
Of course,
healthcare?
Yeah.
Sorry, I'm dominating this time, and I'm dying to know about that carcinogen.
I'll tell you that we've already talked about it in soda pop, but I'll tell you exactly what the ingredient is. But that doesn't have to be a 40-minute thing. This
might be a little boring for some. So with Intermountain Health Care, a couple of years ago, we realized that the health system is sometimes overwhelming to navigate. And I think you and I are probably more confident when we go into a physician and we can go, what are you doing? This is, this just isn't appropriate or something. But I have had people come to me and say, I just do what my doctor says. And I said, we have every right to ask those questions. So what Intermountain Health Care did is we put a case manager in every clinic. Yeah. And so over here at the Heber Valley Clinic, we've got Sarah Finley, who is RN. She worked in our surgery department for years. She worked in Park City's surgery department for years. And she realized that she wanted to impact this wellness initiative that we were working on. So she is now a case manager over here. And what she does is she looks at patients with chronic health conditions. So we're looking at people with heart disease or diabetes or pre-diabetes. And the physician visits with them, but she also visits with them. She helps them understand what choices they're making. She maybe can spend more time answering those questions that you have. Okay, so I was asked to take a beta blocker, but what are some other things I can do? So we have tried, because we understand that the health system can be overwhelming and hard to navigate, that in each of our clinics, we have that case manager who helps you navigate, who monitors your blood pressure, or, say you're monitoring your blood pressure or your blood glucose levels. You come in weekly, you have your blood glucose test, and she sits down with you and says, you know what, here's some information. Your blood glucose is high. I'm really worried about you becoming a diabetic. Right now you're pre-diabetic. So let's connect you with with Betty Wade, and she kind of connects the loops
right.
that are in healthcare. So you're not, when I left this non-Intermountain physician yesterday with all my medical files, one, I had embarrassed my daughter, and two, he didn't give me a course of action. He gave me a prescription for a beta blocker, and he said, call me in 3 months. And I'm like, so...
But what are we looking for?
What am I looking for?
Should it get better? Should it... Yeah, sure.
And so within Intermountain Health Care, you'll find that case manager who will help you connect the dots if you can't get to your physician. Now, we don't have as a hard time accessing our physicians here.
Yeah.
That you might in a larger clinic.
Sure.
We see him at the grocery store. I swim with Dr. Lofgren's wife. So we have a unique community where we see our physicians a lot more in a lot different avenues. But I think that case manager is critical.
Yeah.
So for those patients that need that extra care, extra guidance, even sometimes I'm thinking, I just want to send my kids to Sarah so she can explain to them the importance of their eating choices or their exercising. Because
then it's not coming from mom.
Yeah.
No, I think that's, I didn't even know that about the hospital. I think that's a great, fantastic service, right? Because, again, like you say, when we become accountable, when we start taking these actions, that's when we start to see changes. I mean, I know a lot of people that have been on medication for years and years and years and really haven't noticed any difference as far as feeling healthy or anything like that. They just think that it's good that their blood levels are normal or whatever, but they don't feel any healthier, and I think when they start to actually do things, and I love the prescription for exercise, it's like, look, and not only that, but you're, fully covered as far as, you don't have to go pay a lot of money for that usually.
Yeah.
But, exercise is one of those things we talked on this show, and I think your sister, you were exactly right. I mean, it becomes this 4-letter word. We think about all these things that we have to do, but when we find that thing that we love, then it becomes not exercise. Then it becomes just playing. And we talk about kids' recommendations for exercise is to just play. They say 60 minutes a day, just be outside, play. But for adults, we have to be exercising.
We have to exercise.
We have to get in the outfit. We have to go to the place. We have to, instead of, but what would it be if we told adults, you just have to go play, just go outside.
So I wonder how many adults would think playing is just with the remote.
Yeah, no, exactly. No, we need
rather than
we need to be outside. We need to be doing, but I mean, who wouldn't love to, get on your bike, don't put on the weird bib, don't put on, put on a helmet, but don't get all the gear. You don't need all that stuff. Get on your bike, ride around the block a few times. It's a great time of year to do that.
There's actually a lot of bikers out this
My
really
kids have
early.
been biking a ton. But, go outside and do something you enjoy. If you got a basketball hoop out on the, on the garage, just shoot some hoops and be active, right? Move your body. I think that's the key. And when we talk about things like the pool, what's more engaging? And go to the pool and play. Like, don't go in and feel like you have to swim 4,000 laps. Like, go swim one and then splash around. Maybe don't, annoy everyone else that's there. But, we've lost that ability, I think, to have fun being physical. That all of a sudden we put these in two different jars. Like, well, I'm doing this to have fun, but I'm doing this to exercise. And then it becomes this stress, it becomes this negative, it becomes this thing that we don't look forward to because it's, I have to exercise. But when we find that activity that we love, then it doesn't become exercise. I don't feel like running to me is necessarily exercise, even though if someone else were to get on my treadmill and run for a half hour, they might want to die, right? And so there's this big difference between, right? There's not one thing for every single person. So I would think that would be part of what that case manager does, is come in and say, look, here's some of the options. I know we want Betty on the show next month. I didn't know March was Nutrition Month, so I'm glad you told me that.
Yes, March is National Nutrition Month.
And so speaking of her, right? I know she's got videos that have come out. She's been on some of the news channels down in Salt Lake, and she's been talking a lot about her nutrition ideas, and I think a lot of those are very, very helpful for people just wondering, what the heck am I supposed to eat?
I think with Betty, the thing that I enjoy about it is it's simple. Half your plate, fruits and vegetables, and then she gives you a portion of grains, a portion of your protein. She really simplifies it. She has been very engaged with Channel 2, Ask the Expert. And she's been on TV quite a bit this last year. And then as well as she's been so excited about Facebook videos. We film these Facebook videos of her cooking. and how to simplify and make your meals a little bit healthier.
Right.
And it's just fun seeing Betty. I'm passionate about healthcare, and I know that I maybe come across a little too much. I love listening to Betty speak about nutrition and how just to make simple changes that impact our lives.
Well, and that's what has to happen, right? You talk about the complexity of the healthcare system. I was talking about it someone with an actual doctor yesterday, and he was talking about how really over the last little while we have step by step complicated everything.
We have.
And we built the house, right? It's America's to blame. It's not one person or one, we got all the conspiracy theories. We've built it, right? We built it, what I said, brick by brick, right? Every single year or month or whatever, we've done something to complicate it. And so now we look back at this huge labyrinth that we've created for patients to try to figure out, okay, now how do I optimize my health? And I think you're correct, is the way that we do is we start to simplify it. Right, and how do we make it easy for someone to say, hey, instead of eating this, I'm now going to start doing this. Or instead of trying to not eat this, I'm going to instead add some of these great things, right? If my plate was half fruits and vegetables, after I ate that, I wouldn't have a lot of room for the other half to be, to be a lot of junk. There's only two halves,
Yeah.
So, and so that's a simple thing, right? Just add more good things. And I think as it becomes more simple, that's where people start to really grasp it and say, look, this is a lifelong thing that I can start to do. These are changes that I can make forever and live a healthier life. And then I think one good choice starts to tumble, into better choices. Because again, our body tells us, yeah, this was good. This is something that I should be doing. Whereas I just don't think that happens in a statin drug or a heart pressure. We need some of those to lower some of these, but we don't grasp hold and say, oh, look, my cholesterol is lower. I feel so much better.
Yes.
But, hey, I've been exercising regularly for the last 3, 4 months, 5 months. I can tell now, right? Because you say the reason we exercise is because we know if we feel better. We know that if I didn't exercise tomorrow, my day would be different. I would be more tired. I would be foggier. I know what happens when that difference is so glaring to me, where people who don't really make it a habit don't really notice that difference. But once that happens, then they say, oh, I can really grasp these changes. And so really what we're talking about with these wellness initiatives that you guys are really pushing and doing a great job with is starting to give us things that we can grasp, tangible things that we start to say, hey, I feel healthier. I feel like my life is on track more. My health is on track. And so I applaud Intermountain for being at the forefront of this, especially in our community. I mean, you can't go to a health fair or some healthy activity without having Intermountain sponsoring some part of it. And I know you're a big reason for that. And even coming on a show like this, where really I am all about getting people out of doctor's offices, out of, as much as they can off their medication, all that kind of stuff. And like you say, for people in the business of treating injured or sick or whatever, that is a bad business thing.
It is a bad business model. But in 1975, the Intermountain Health Care was owned by the LDS Church. And they owned, I think it was like 20 hospitals. And the LDS Church at the time felt like they needed to get out of the healthcare business. They realized they were a church and not a healthcare company. So when they turned over Intermountain Health Care, they could have sold it. They actually had a lot of suitors for millions of dollars. So the church could have made millions of dollars selling this healthcare company. But rather than sell it and have it become a for-profit company, Victor Brown was the presiding bishop at the time. He interviewed and created this governing board. Yeah. And so we have a governing board that oversees all of Intermountain Health Care, and then we have a local governing board. So we have Robert Hicken, Grizel Zelaya, Laura Camper, Reggie Probst, Paul Weller. We have about 10 Byron Day local community members that help us guide the vision of our hospital. Cool. So when Victor Brown turned it over to the first board of trustees, he said, make this a model healthcare company for the nation. Yeah. And as we've assessed what the nation says about us, we really are the leader of healthcare and of this vision of putting ourselves out of business. We're impacting financially, which we really want to impact health, so we're impacting health, but we're also seeing cost savings that then can be passed along to the patients. And, I still hear people say, oh, you charge so much for an MRI. Yes, but for patients that need that MRI, that is what that costs, and we're pulling costs out of it as we go.
Right.
But if you need an MRI to rule out a tumor or something else, that tool is available to you. So I really think Intermountain Health Care as a whole has met the church's call to become a model healthcare company.
And when we had Sean on a little while ago, we talked about that too. And I think it definitely opened my eyes as far as, really people are looking at it. He said he was working out in Oklahoma or something and had heard, about Intermountain. So I think that's really such a great thing, and it's such a good thing to have in our community. And like I say, I think as we laugh about this bad business model, but when people see Intermountain out at these healthy things, really promoting people's health, and I think they understand that for you, it's not a business. It's not a how can we get as much money out of people as you want, right? If everyone that walked in the door at Intermountain said, hey, you probably need an MRI, you guys would make a lot of money,
Yeah, we probably would.
But it's not good, people realize that they feel like, hey, I'm being taken advantage of, or hey, they're just trying to make money off me, when really you can sense from a practitioner, from a system, from whatever, you can sense when they're really looking for your best interest, not their own, right? I kind of laugh when someone says, well, I got this MRI and I don't know if I really needed it. I was like, well, he might have just bought a car, you never know.
He might.
Maybe see if one of his kids went to college recently.
See what he purchased or where he took his family. One thing so we have been in the healthcare system on the patient end of things since early December. And, I've had Dr. Lofgren and Dr. Graham working with us, and I appreciate that I can ask them, is the MRI or the CAT scan going to impact the course of care?
Right.
Do we need it to determine the course of care? No, we're not going to do an MRI.
Yeah.
No matter what, I'm going to do this same thing.
Yeah.
Or if the instance, she's had chronic headaches for 3 months.
Right.
We do need to get in there and do a CAT
Something
scan. We need to rule that out.
As long as there's nothing there.
I appreciate that our physicians are very engaged in that model of making sure that we're not putting extra costs into healthcare, that we're pulling it out and we're treating the patient.
Right. Well, and that's how we get the system not to bankrupt. That's how we make it so that these costs don't continue to rise, right? We need people to start living healthier lives. Mm-hmm. I mean, that's how we have to get the cost of healthcare down, I think, is the way.
Yes.
And as long as practitioners are starting to push it and move towards there, then that's how we're going to see it for sure.
Yes. And so that's why swim lessons are important for little kids, because if we establish
Let's
a lifelong
bring it full
pattern,
circle, right?
So I'm we went really off a tangent for you.
That's why we have fun doing this. Well, swim lessons are important. I think I wrote it all down because I want to see if my kids are going to get involved, because I think they would love it.
Well, I will post everything to Heber Valley's Facebook page, and I'll share it on the Health and Wellness page on Facebook.
Perfect.
And then I'm redesigning our website right now, so the information is in there, but it's a little complicated to find. Facebook right now is probably the best location, or you can call my physical therapy department is 657-4690, and my office number is 657-4301.
And they can call you and say, hey, remind me when.
Remind me who I call.
Was it level 4 at 3 or was it level 3 at 4?
4. Or one's level 6. Thank you for having me on.
Hey, Amy, thank you again for coming on. Again, I all of the guests from the medical center have been really fun, and so I appreciate you kind of helping setting that up also, and then we look forward to having you on as much as you want to come.
Well, it was really fun. So I'm a little passionate. I'm sorry.
I love it. No, it's fantastic. So we have 5 minutes left. I'm gonna reveal this. I know I almost feel bad because this is kind of that trick where if we're watching a show and they're like, oh, and at the end we're gonna reveal, and then of course it's always the very last minute. But we are gonna talk about caramel coloring in soda pop, and this has been known to contain. This is the ingredient 4, and the chemical term is methylimidazole, but MEI is what they call it. So 4-MEI is this. It is a cancer-causing compound. It is known to be a carcinogen, and and it is found in caramel coloring that we have in soda pop. And so what this study aimed was to try to figure out how much soda people are drinking, and really what they came up with is that 44% of kids and 58% of adults drink at least 1 can of soda per day. And so we're looking kids over the age of 6, again, almost half of them and more than half of the adults. And then they analyzed all this caramel coloring and tried to find the 4 MEI concentrations. And they found that it actually varied, which this is the crazy thing, is because you can't look on your soda can and find this ingredient. 4 MEI is not going to be listed, but the caramel coloring is. But the reason it got through the FDA and was still okay to have in there is because it varies how much of this compound is in this caramel coloring. The thing that makes me the most angry is the caramel coloring has nothing to do with the taste, has nothing to do with the actual drink itself. It is just for aesthetics. It's completely just to turn it a specific color. And so if there's caramel coloring in that soda, again, we know that there's 4 MEI in there, sometimes smaller doses of it and sometimes larger, and there's no way to find out just being a consumer. And so I think when I talk about artificial colorings and food colorings being part of my lists of ingredients to avoid, I'm going to have to definitely include not just red 40, not just yellow, whatever, but I think caramel coloring's got to be in there, because with this new development, right, we know that cancer's on the rise. We know now that 1 out of 2 males are going to be diagnosed with it in their lifetime, 1 out of 3 females right now. We've got to stack the deck more in our favor. And so if you're a soda drinker, which there are many of them out there, I should say us, I drink it every now and then. I'm not 1,000% don't drink it. But I would say that as much as we can obviously decrease it, that's going to be the best. But if we can get this coloring out of there. Now, obviously there are groups now calling for, hey, after this study, they say, look, we need to get this thing out of the drinks. Hopefully, again, consumer dollars is what really drives it. And if we start to say, hey, you know what, I don't want to drink sodas that have the caramel coloring in it, then perhaps we're going to start to see some of these companies listen to that and say, look, it's an extra thing we just put in there to make it look a certain way, so let's just take it out. I think, that was the thing with the Subway sandwiches. Their bread had that yoga mat component in it. I don't know if you guys remember hearing about that, but they had something in it that's contained in yoga mats. All it was to make the bread look a little fluffier. And as soon as people found that out, they were not very happy about it. And so Subway said, hey, we're not going to use that anymore. I would love and call for some of these companies that say, hey, we use the caramel coloring. We want the dark drinks. I don't know why we like the dark drinks anyway. But if we can start to pull that out, I will tell you that think of the exposure to this carcinogen, this 4 MEI. Think of how much we can decrease that exposure and just help our body in general. And so anyway, we'll leave you with that thought. Again, look for that caramel coloring, not just in soda pop. It's going to be in a lot of these darker coloring. It sounds good to me, right? Caramel coloring, because I love caramel, but but they're not just putting caramel in there. And so watch for that when you're looking at your ingredients. Definitely in the sodas. Please don't have your 6-year-olds drinking a soda can a day. I can't believe that half of 6-year-olds are drinking a can of soda a day. There's things that they love to drink that you can get them. Again, I've said that my favorite, the kids' favorite treat to go get is a bottle of kombucha down at the Real Foods Market. They love that stuff, and it's got all the probiotics and everything. And so don't think that because you love soda pop, then your kids automatically won't love anything else. I mean, there are many, many alternatives. But if we can start to decrease that usage, start to decrease that caramel coloring that we're putting in our body, decrease the 4 MEI. Again, I want to put out that the FDA will approve things that will give you cancer. I mean, I hope, and I'm not trying to be conspiracy theorist or anything like that, but here is a great example of us having a known carcinogen in something that we use day after day after day. And so anyway, on the fight for cancer, get out and exercise, use the pools, get swimming for sure. But man, if you can decrease some of these things that you're willingly putting into your body and putting you at risk, I think that's one of the biggest things you can do also. So caramel coloring, get it out of there. 4-MEI, look for that kind of stuff when you're buying your foods, because again, it's not to make it taste better, it's not to make it last longer, it's just to make it look a certain color. And I'm going to be on the lookout a little bit more myself. So on that note, we're thankful and glad that you guys were listening. Hopefully you guys have a great day. Again, crazy winter continues. It's beautiful out there. Get out and ride your bike. Go for a walk. Go for a run. And if you do it for no other reason, do it just for the health of it. Thank you for listening.